Hello. So this is my video for starting to move your pelvis and your lower back to release tension. And this technique can also be used to help with bringing the baby down into a good position for birthing at the first stage of labor. So a little bit of background on what we're looking to achieve with this series is thinking about expanding our hip bones. So we have two hip bones that sit right here, and our pelvis is shaped like a bowl. Okay, so you can kind of visualize it like this. And you can even put your hands right there to help you visualize what we're trying to achieve with breath and movement. So for some women, we have what's called excessive form closure of our SI, so our sacroiliac joint, okay, and all of the muscles that surround it. Usually women that are quite strong in this region hold a lot of tension. Why that is something that we may want to address is because if we can expand through the top of the pelvis and release tension through both these bones, the lower back, the bone at the back of the spine, what that allows for the baby to do is to send their head down into a birthing position. As you know, or if you don't know, the baby needs to be head down in order to come through our birth canal. So widening the pelvis at the top is really important to help guide baby out. We're going to be using the reverse Kegel diaphragmatic breath in this video to help expansion. You can always look at my reverse Kegel video for more guidance on that if my cues in this video are not as clear as maybe they could be. So I want you to visualize these two bones, okay? And at the base, the cervix would be here, all right? We're going to breathe down into the ilia. How to do that, it takes practice, okay? But we can start by just placing the hands on the rib cage, and you can apply a little bit of pressure inwards to help guide you. Now breathing in, we want to expand through the bottom of the rib cage. Now what I want you to avoid doing is on exhale, blowing out like this. Okay? If you just blow out like this, you'll actually feel the abdomen contract. That's really helpful for a push stage once the baby's all the way down. But at this stage, we want to fill up and expand, and then on exhale, we want to soften. So breathing in, and then just letting the air go. If you're getting a lot of SI pain and having a lot of issues around this region in regards to tightness, throughout the day, it'd be really good if you could tap into this breath and really notice if you're blowing out on exhale. So let's go again. We're going to breathe in and let go of air. Just letting go of air can be quite difficult when you first start practicing it. Breathing in and just letting go. You may even want to practice this lying on your back if it's too difficult seated. I'm seated on a yoga ball right now, or a stability ball. So let's add some visualization into this breath technique. So pelvis sits like this, okay? As you're breathing in, I want you to think about expansion at the top of the hip bones, and then just letting go. You can bring this awareness to the back if you're getting a lot of tension at this lower back. Breathing in and thinking expanding, and letting go. You might not be able to see here. If I put my hands on my thighs, I just added a really organic movement to this. Breathing in, expanding the femurs out, thinking about expanding through the top of the hip bones, and exhale. You can actually feel your hip bones. Your hips are this high. That's the top of that pelvis, right? A lot of people think our pelvis is way down here. We're really breathing and expanding quite high, and then letting go. Great. Now if you have a stability ball, adding some movements in with this breath technique can help guide baby down and can also help release tension in the upper pelvis and allow that tissue to accommodate as we get bigger. So I'm just going to leave my hands here for visualization. So our pelvis is a bowl and our hip bones go this high. So we're going to breathe in and out. So I just tipped backwards. So that might feel safer to do so, and even good if you can visualize the very back of those SIs opening up as you breathe into the back and then exhale closed. Now we can tip forward, and that's going to open the front of the pelvis. May be helpful if you're having a lot of pain in pubic symphysis region, front of the pelvis. Breathing in, exhale closed. Some other movements would be tipping to the side, exhale close, tipping to the other side, exhale close, or rotation. So you can see I went back to a pursed lip breathing. Really try to avoid that breathing in and just letting go. So really focusing with movement. There's no right or wrong movement. You can go front to back, thinking about the pelvis as a bowl, side to side. We can do circles. I'm exaggerating here. They don't have to be big movements. Start slow and work your way up slowly to get more range of motion pain-free. If you have any questions, let me know, and hopefully you find this helpful.